I just informed people here in Germany about the results of the TOGA trial. This is a multinational trial that was performed in Europe, in Asia and in other parts of the world. We sampled 4,000 tumor probes and we looked for the expression rate of HER2. HER2 is a growth factor receptor belonging to the epidermal growth factor receptor family. Its overexpression is known from breast cancer, where overexpression is found in about 25% of patients, but it was not yet known how the overexpression rate is in gastric cancer. So we sampled 4,000 probes. We did gene testing for HER2 overexpression by means of FISH, and we also did immunohistochemical testing of the HER2 protein overexpression. We found that in 22% of the gastric cancer probes there was overexpression of the HER2 protein. Those patients who had an overexpression of the HER2 protein could be enrolled in the TOGA interventional trial. This was a randomized phase 3 study that randomized patients to receive either chemotherapy alone, which consisted of cisplatin plus 5-FU, or cisplatin plus 5-FU and Herceptin. Herceptin is a monoclonal antibody that is directed against the HER2 protein. The primary endpoint of this study was overall survival. It was the aim of the study to show that by the addition of trastuzumab to chemotherapy, overall survival of the patients can be prolonged. This was actually the case. The median survival of those patients who were treated with chemotherapy alone was 11.1 months versus 13.5 months in those patients who had a HER2 overexpression. As secondary endpoints, also progression-free survival and tumor response rate were also prolonged. We looked at those subgroups who have the highest benefit of the therapy with trastuzumab, and it could be shown that those patients who had a so-called 3+ overexpression of the HER2 protein measured by means of immunohistochemistry were those who had the highest benefit from therapy with trastuzumab. Meanwhile, the European agencies have approved the use of trastuzumab in the European community, and since the end of January we are testing all patients who present with advanced gastric cancer. We test them for HER2 overexpression, and we have the possibility to offer to those patients a therapy that combines chemotherapy and therapy with trastuzumab.